Hey Refam, my name's Kate and welcome back to My Surgeon Says, the podcast with real surgeons, real experiences and real advice. Today we're talking all things money. We explain which costs are actually included in our quotes, common cost-cutting tactics that cheaper providers may use, and why a high price point doesn't necessarily mean you're getting a surgeon with more training and experience. As always, please leave us a 5-star review and subscribe to our little podcast wherever you're listening. Let's get into it. After your initial consult at RE, you'll sit down with a surgical coordinator and she'll do an all-inclusive price. Mm-hmm. What does that actually mean? What does that entail?
So it'll depend on what procedure and whether there's an item number or not and whether you've got private insurance. Basically, there'll be a surgical fee, an anaesthetic fee and a hospital fee. If there's an item number and you've got insurance, you'll get some money back on surgical fee, anaesthetic fee, and you might have a one-off fee for your private health insurance. You won't have to pay a hospital fee. If you don't have insurance, then to make it simple, you'll have to pay for the hospital, or if you don't have an item number for your procedure, you'll also have to pay for the hospital. And you wouldn't get any rebate on the surgical fee or anaesthetic fee.
And the only other fee that you may get is if we send pathology. So the particular one for that would be breast reduction. Yep. If you don't have insurance that covers your hospital stay, you will then get a bill from the pathology for the testing of the breast tissue, which we always do because we think it's very important.
In our surgeon's fee, the post-op appointments are included. Mm-hmm. Do you know if that's standard practice?
I think with Medicare, there's this fixed amount of time where it's standard, maybe 6 weeks. So I think some practices do charge you if they see you beyond that.
I never have.
Is there anything that patients forget to commonly budget for with those? Maybe not with us, but just if they're seeing prices somewhere, is there something that they might not be factoring into when they're comparing costs?
More maybe if you're looking on a website, it's hard. We've tried to have as much information on our website as we can, but it's sometimes hard to provide a quote for the hospital because there is slight variations and it depends exactly what you're doing. So it's sometimes hard to actually put a price, and we've tried doing it as a range, but the regulators weren't happy with having a range. They wanted a specific number, which we can't provide, so we had to take it off. So I think if you're looking at prices and there's a big disparity, it might be that they haven't included either the anaesthetic fee or the hospital fee. I think leaning into your question a little bit more is budgeting, if you're not insured or if there's no item number, is budgeting for a return to theatre or a longer stay in hospital. An extra day in hospital might be something which would be reasonable to consider, which is, I think, around $1,500. Something like that. It's pretty uncommon to have to stay longer, I've got to say, and pretty uncommon also to have to go back to surgery. But if anything, an extra day in hospital you could consider, but I'd say less than 5% of patients would have to do that.
Where might a cheaper provider be cutting costs?
They could be doing the surgery as day surgery, so no matter what the procedure. So
can't do a tummy tuck as day surgery.
With non-surgeons, Is it now fully banned to do in your rooms procedures or no?
In theory, yes. You have to have an accredited facility to do. But there's a place on Chapel Street that advertises for liposuction, and I know they don't have. And I had a patient that I did some abdominal liposuction on a few months ago, and they'd had thigh liposuction there. I guess if they've got a proper operating theatre that's been accredited by the accreditors in their office, they could, but in theory that they can't do that anymore.
I think the whole tummy tuck as a day surgery procedure is, I think it's a stupid rule.
I've never even heard of that one.
Yeah, no, it did come in. The rule was brought in to try and stop non-surgeons from doing abdominoplasty because they don't have operating rights, so they wouldn't work at a facility where they could keep someone overnight. Obviously, much better to stop unqualified people from operating. Not that I would commonly want to do a tummy tuck as a day case, but I think it's certainly feasible in some patients to be able to do that. So I think they're trying to tighten the regulations on what the standard of the facility is so that it's harder to do work outside of hospital. I think in the long run, that's counterproductive for a lot of people because hospitals are getting more and more expensive for these sorts of procedures. But it's prohibitively expensive for us to start our own day surgery procedure or hospital because of these additional regulations. So in America, very different. They all have their own day surgery procedure and they do very extensive office-based surgery under a general anaesthetic. And the reality is most plastic surgery we would be able to do in that type of facility, but rather than prevent non-surgeons from operating, they've decided to put the bottleneck at the facility, which in the long run I think disadvantages patients. If there was a reasonably cost-effective way of providing a facility, like I think more plastic surgeons would do that and we'd be able to at least control that overhead a little bit better, but it's prohibitively expensive. We just can't do it.
The other fee that may be scrimped on would be the anaesthetist fee. So just about every procedure that we do under full general anaesthetic, I guess if you were offering a patient no anaesthetic, so local anaesthetic only, which could still be done in a hospital, in an accredited hospital, then you're not having to pay for the anaesthetist. But as I said, like most things we do, we would never even consider that. Beware if someone's saying, we can do your surgery, day surgery, and no anaesthetist. If someone is less qualified, then they, and this is regulated against as well, but it doesn't mean it's not happening at all. The person that was doing the procedure was actually also doing the anaesthetic, so giving you make you a little bit sleepy, but then they're not monitoring you because they're monitoring you and they're not doing the surgery right, or either way they're not doing
Crazy
it
to have
right.
less experience and skill and double up the role.
Yeah.
It's like you really want to be focusing
Yeah.
on the first one,
But it's cheap.
Or they might have what's called a GP anaesthetist.
Oh,
so
okay.
they might, like, particularly for sedation, they might have either a nurse or a GP just giving some sedation while they're doing the procedure.
Obviously, we're alluding to the crackdown that's happened on non-surgeons in the past couple of years. Whether the effectiveness of that is great or not is for another podcast. But in terms of being cheaper, I feel like you would typically think that would make them easy to spot. But is that always the case?
I don't think so. I don't think the people that were prominent in the past 5 to 10 years, I don't think were necessarily cheaper, but maybe a degree, but not a whole heap.
No, much to my chagrin, I've had patients come in and tell me that I was cheaper than some of the non-surgeons, which that was humiliating.
And I think one other area where you could potentially get lower costs would be breast implants. So there's 2 now or 3 sort of main breast implant providers or that have implants in this country. There are a number of other smaller companies, and there's definitely lots more companies overseas. And so if you're going overseas for surgery for a cheaper price and they're selling you implants for a much cheaper price, who knows what the quality of those implants are.
I know it is funny researching this within the context of Australian, because a lot of the things on the internet are about America or
Turkey,
Thailand, whatever. And so it's like to be aware of what implants they're using, or they're using cheaper surgical tools and stuff. And the things, like if you are going to an accredited plastic surgeon in Australia, those things aren't actually impacts in it. Yeah.
Yeah. So in the, I think it was early 2000s, there was a big scandal in France where they were using mechanical grade silicone in implants rather than medical grade, and that was causing a whole heap of complications, which was actually the stimulus for developing the Australian Breast Device Registry, so to track these sorts of things. I think if you're outside of Australia, which is very tightly regulated, there could be any number of materials being used.
I remember so vividly the thing in France.
And
I feel, when I started here, I was like, well, we don't use silicone because that's bad, because I still just had the French thing so prominently. Anyway, that's a little aside for the reader.
Anecdote.
What about experience and training? How does that impact cost?
When you're starting off, you don't have experience that you can lean on. You don't have a whole gallery of photos. You don't have 200 podcasts of knowledge that we've shared with patients. So The only leverage you really have is perhaps a lower price point. As with anything that is maybe better quality or more experience, there's a cost that is associated with that. Dare I say, even some of our colleagues, not so much in Melbourne, but other states, do train GPs and non-surgeons to do breast implants in particular. And so if you go to that practice, you can choose the surgeon or the non-surgeon, and the non-surgeon is then cheaper. We're not big fans of that sort of way of doing business.
In terms of the dangers of cutting costs and the risks there, you're doing surgery somewhere cheaper, not a great job, and then maybe people are like, okay, well now I'll just go get it done the right way at the more expensive place. Is that always how it works?
Revision is usually much harder than the primary surgery. So depending on what a patient's had done.
Yeah, the issue is you've already paid once, sometimes not as cheap as what you thought it might have been, and then revision surgery is a much bigger challenge and is more costly because it generally would take us more time. So a revision breast augmentation is generally going to take more time than a primary breast augmentation, and so there's increased cost for us, increased anaesthesis costs, increased hospital costs. I think you can break the complications into two areas. So there's medical complications, what Kim's alluding to. So there's serious complications, and we've seen all of these things over the last few years. I'm not saying plastic surgeons are completely clear of having ever had these complications, but there's definitely a proclivity for them in non-surgeons. And I'm talking about when liposuction cannulas have got into the wrong space and injured internal organs like lung, liver, spleen, or overwhelming serious infection. So there are serious medical complications as a risk of going to people who are not qualified. And then there's the more nuanced outcome issues where the result hasn't achieved the outcome that you maybe were expecting or had hoped for. They can happen to any surgeon with even the best of intentions and the best of qualifications. I think it's important to differentiate the two groups there. The first group, you need urgent medical care. The second, it's a lot more nuanced and maybe could be addressed with revision surgery. You've got more time and can consider that.
We've done a deep dive on the issues with destination surgery, which I'll link in our show notes. But what about in particular, what issues will people run into in terms of aftercare when they're coming back to Australia?
There's a whole raft of things, and as Richard just said, there's like more emergency type of things. And on top of the things you just mentioned, severe infection, severe bleeding. So if you've had drains that are just ongoing blood in them, or if you've got wounds that are still bleeding, these things actually happen. Patients jump on a plane. There's sort of middle things where wounds are just like grumbling along and low grade healing issues. And you need to be seeing someone that's got good knowledge of what surgery you've had to be able to give you good advice in terms of looking after the wounds.
What protections do Australian patients have that overseas ones may not?
Nothing, actually. And it puts them in a very difficult position because what Kim was alluding to, the low-grade things, wound infections or poor healing, no plastic surgeon is going to really want to take that on because there's just no upside to doing that. We're not equipped to doing it. We don't have the facilities to do it, to do regular dressings like that. So then you're really stuck with the public hospital system, which also is overwhelmed with other things. And let me tell you, the people who work there, they're condescending enough of cosmetic surgery. You can't imagine how condescending they would be of someone who's gone overseas to have cosmetic surgery. And they often, it's horrific, but often hear what gets done and there's a wound, and rather than give it time and use other strategies, they'll just cut the skin out and put a skin graft on, which is just, that's going to be almost unsalvageable. They're not there for the aesthetics. They just treat it as if it was a burn or a road trauma, and they see a wound and this is how we're going to heal it. And so you've gone into something wanting an aesthetic outcome and you end up with a skin graft on your tummy, which is not going to be ideal and going to be difficult to rectify. So there's not really much protection. And unfortunately, maybe intended consequences of these regulatory changes that overseas practitioners and these tourism groups are not restricted with their social media. Who knew, but Australians can actually see content from people overseas. They do testimonials and they do vlogs of their journey, and we're not allowed to do any of that stuff. So I can see why it's attractive to people, because they have someone who has gone over there for a facelift and they've mapped out the journey and the hotel room they're in, and everything has gone great, and we can't do any of those things. And so people get bombarded with overseas things where it's not a level playing field. One way to protect Australian patients is to ensure that surgery is done in Australia, where the regulations are high and the standards are high and the training's high and the facilities are high.
On the converse to that, if you're one of our patients and with the experience and time that we've had, and particularly in the procedures that we do, if you are one of those unbelievably rare people that does get a complication, we are here for you for the journey. It's not just about doing an operation. It's like we have lots of routine follow-up. We will see you extra times if need be, and we're here for the long haul. If you do have any kind of emergency, but also if you've not 100% satisfied with your result, we're happy to be seeing you for the journey.
I just saw a patient today who I revised his abdominal scar 6 weeks ago from a body lift that I'd done, I think, 5 years ago. And he came back in and he said, look, I just part of this wound, I keep on getting a pimple or a blister. I took him to theatre. I revised the scar. He wasn't out of pocket. This is well beyond any sort of duty of care. I don't know what's caused it, but he's a patient of mine. I don't want him to have an ongoing wound. And so we take care of it. But if you've had your surgery in Turkey, what are you going to do? Fly back to Turkey? It's like, that'd be a turkey.
Also, Turkey is so weird to me as an Australian because it costs so much to get to Turkey.
Far.
I get it as a British person, you're just hopping over, but is it?
I would love to see the actual price breakdowns of travel, companion travel, hotel accommodation, and actually put it side by side against sort of an uninsured patient having surgery here. I think people would be surprised to see that there's probably not as much disparity as what they think. And I understand they think they're having a holiday.
They're having a holiday.
It's no holiday.
I can't imagine anything worse than 40 hours on a plane after surgery.
I know.
It's already hell when you're just going over fully fit and able.
You're flying first class. Imagine.
Yeah, I know. I don't know what these suckers are doing back there with their plastic cutlery. Am I right?
I have flown through Istanbul airport once, and the number of people with bandages on their head, that was the most popular one for that hair that you could obviously see,
turkey.
the men.
Mike has a full head of hair, but the only ads that play during sport are sports bet and hair loss ads. And that's it. And so he's so deep in his head. He's like, I've got to go to Turkey to get hair. And I'm like, what are you talking? You have a full head of hair. And he's like, I'm balding. Wow, you guys only have one insecurity that they play on well too. The excessive gambling. On the inverse to cheap and cheerful, can an expensive price tag be misleading?
Anything can be misleading.
Yeah, it's the horseshoe theory of anything. Like at both ends of the cost spectrum, there's probably things to be concerned about.
What are red flags that it's more marketing hype than actual skill?
I think, I had a patient today, again, I've had a big day. Patient today went somewhere to discuss some minor tear troughs. It went from, that's what concerns me, to a deep plane facelift, pinched lower blepharoplasty, revision of her upper blepharoplasty, a brow lift, full face laser, Botox for her masseters, who didn't need any of those things, in my view. One component of facial rejuvenation to a full suite, and you need all of these things, otherwise all of it is going to be a complete failure.
A massive upsell.
So, yeah, I think an upsell, which is different from making a full assessment of someone. So some people will come in, and recently someone who came in wanting upper blepharoplasty, but the problem was clearly her brow. And so we did a brow lift and a small blepharoplasty. So not all, a full assessment is still appropriate. I think if it goes from sort of one area to like the extreme.
And they're like, have you actually looked at your breast? They're gross. You're like, whoa, okay.
Yeah, that's a common phrase I use.
And also, look, ask their experience. I used to see images of someone similar to you. We have thousands of photos that we
Tens
can
of thousands.
use to share and find a patient that's a similar build and size to you to be able to be like, this is what I think we can achieve.
That might be the answer to my last question, but I'll ask it anyway. What's your best advice for balancing cost, safety, and results?
Come and see us.
If you liked that episode, there's plenty more where that came from. Maybe start with some of these or head to our channel for your peek into the mysterious world of plastic surgery.